on this episode of Africa Health Check.
How do I get work? How do I still get income into my company?
I managed to learn how to work remotely, and that has been quite helpful.
We showcase the extraordinary efforts and resilience of individuals across Africa.
Even when there are challenges, that's where you get opportunities. We saw a problem and we wanted to get a solution for it.
Who emerged as heroes during the challenging times of the COVID-19 pandemic? Not all heroes wear capes. This is a fact we all had to reckon with during the COVID-19 response, where we saw ordinary people doing extraordinary things to save lives, raise awareness, and indeed add value to overcoming COVID-19. On today's episode, we will be discussing pandemic heroes. I am your host, and I welcome you to Africa Health Check. I'm joined by our experts, Dr. Marianne Morathi, the chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who's a pharmacist and a pastor from Ghana. But before we hear from them, let us have a look at this episode's feature story.
My journey as an entrepreneur in Kenya started very many years ago. In fact, Silmark Agencies was registered in 1988 when I was just like 24 years old. Genesis Care is an impact company which does end-to-end menstrual hygiene solutions. That is what we offer mainly. There's a big problem of access, affordability, and safe disposal of menstrual waste. It was very important that after removing a mask, you handle it right so that you don't even contaminate yourself with it. And our incinerators came very handy because we reduced the use of the second person to handle the same. So the user usually just used to go to the incinerator, just drop the used mask there, and they go their way without having someone else to come and collect. Probably they were disposing it in another container and maybe take them elsewhere to go and incinerate them. So we reduced the use of double handling by incinerating on site. In terms of our products, we have the sanitary pads. And also we have sanitary pad dispensers. The dispensers come in 3 types. We have a sanitary pad dispenser which can use a coin. Right now those are the ones we are using in schools, in universities, and in places like slum areas, like in Kibera we have some, whereby one needs to use a coin to dispense a sanitary pad. Apart from that, we have other dispensers, which one can use M-Pesa. Actually, that is a product which came during COVID time because, of course, no one wanted to touch our dispensers because you had to touch to turn a knob to dispense. So that's when we came up with the innovation of a sanitary pad dispenser which is hands-free. And how it is hands-free is you just go to your mobile phone, you do buy goods or pay bill, then you pay maybe like 50 shillings. Then if a sanitary pad is 10 shillings, it will dispense 5 sanitary pads for you, and you just pick and go without touching anywhere on the machine. We came up with the incinerator and the dispenser first. Of course, we had to do the prototype 2016, 2017. 2018, when we tested and we saw it was working, we went ahead and did a patent for the 2 products. So the 2 products are actually patented locally. And after doing that, now we went into the market because we discovered that the problem of disposal and access to menstrual products was not only in our village, it was huge. I remember around that time when we were doing our research, I found out that like a place like Western Kenya, they were still using products like cow dung as a sanitary, as a product to take care during that time of the month when they were having their menstruation. So we discovered the problem was big, and with the incinerator, especially with the incinerator and the schools. So that is how we went into market with the incinerators and the dispensers. Then come 2019, one day as I was just watching the television, you remember when it happened, everyone was scared. We didn't even know what we were dealing with. The masks were very expensive. I remember around that time, one could cost like 500 shillings. And 500 shillings, and then it's something you're going to dispose in a day. That was very costly. So I just saw on telly during news time that someone had collected those used masks and washed them and was actually selling them to unsuspecting people in town. So that got me thinking, and I was like, can we do something about disposing those ones at source? And actually that is what meant us now pivot our menstrual incinerators to start now incinerating the masks and later other PPEs like the gloves. What I would want probably to speak to other entrepreneurs like me is that even when there are challenges, that's where you get opportunities. Because like for us, we saw a problem and we wanted to get a solution for it. We did not know that a business would come out of it. So even when there are those global challenges, especially like what we got in COVID, there's always something one can do as an entrepreneur, because entrepreneurs are very innovative, and once they identify a problem, they're able to go into research and probably come up with a solution. So I would encourage them to just try and see what they can do to solve that problem, which has come in, because it's actually an opportunity. Challenges actually pose opportunities for entrepreneurs.
Wow, a very, very remarkable story. Touchless sanitary pads, dispenser, and an incinerator for mask and PPE. Who would have thought?
Amazing.
Well, she says that when challenges come, there is also an opportunity.
Yeah. Absolutely. I think it's just really a powerful story about turning a challenge into an opportunity. And isn't it quite interesting that she's actually saying that they were not looking at the money aspect or the business aspect, they were just trying to provide a solution. And then exactly, it's just incredible. So we're talking about COVID heroes. Who are your pandemic heroes, Dr. Marianne?
Oh, wow. Pandemic heroes, there are so many. Of course, I'd point out the healthcare providers.
Yes.
They are the ultimate heroes. They faced a problem. For me, they were like Superman, and they were able to treat the people who are really affected, the doctors in the ICU, people with the highest amount of virus in them, and they were not afraid to treat them, and some even lost their lives. So for me, those were my ultimate heroes. But other heroes as well for me were also teachers. Teachers at that point were saying that our kids or children, we call them factories of germs. Okay, why do I say that? They carry everything. A child will run or will do everything, carry the germs, take them to class. But for me, I was thinking of that teacher who has to interact with his children, and a teacher who is hypertensive or diabetic or was more vulnerable. But yet these children will come and either transmit or carry all these infections to them, but still they were resilient. loved our children despite the dangers they faced. In Europe and particularly in the UK and America, teachers were afraid to go back to class.
Yeah.
But here I saw teachers actually eager to go back to class despite the challenges that they were facing at that point, and were able to interact with our children and do what they have to do in teaching them and love them as they should. And for me, they were my heroes as well.
Absolutely. Absolutely. Reverend, who are your pandemic heroes?
Yes, the idea of a hero is someone who risked his life for something and was willing to sacrifice something for the common good of humanity. COVID precipitated a whole lot of things upon us. People were afraid to go out. People were clinging to the little that they have. People were losing jobs and money all around. But here are others who are willing to lay their own issues aside and reach out to others. In that understanding, then even our donors, people who donated all these vast amount of vaccines, so Africa will remain. It's worthy of mention. CDC Africa, in fact, Africa Health, check and putting this program, educating the public so people understand what it's all about, debunking all kind of misinformation and all those things so people can actually live. But I'll side with Dr. Miriam, the frontline workers, doctors, nurses. I heard that some couldn't even come home because the need calls for them to work overtime. Not necessarily for any financial incentives, but for the fact that someone is on the point of death and I can do something about that. I think these are the highlights, but students who came together, went to villages, unreached places, some going by canoes and bicycles. And I heard a story of a lady in, Lesotho, climbing the mountains on donkeys to make sure that it's a nurse, so that people receive maternal care and all these things. They are people to be celebrated. So it's a vast, I will begin bring the bottom line is even the mothers that were at home. Most of our communities in Africa, they don't have refrigerators at home, so they have to go out in search of food and something to keep the family running. And the risk of contracting the disease, but life comes first. And to such people, we say congratulations. We hear them.
Absolutely. I think we also witnessed an emergence of unlikely, heroes in the middle of a public health emergency. I don't know if this happened in Ghana or in Kenya, but in Botswana and in South Africa and a couple of other countries in Southern Africa, it took some time before we had a lot of cases of COVID-19. And I remember when the prevalence started to peak, there was this narrative that is coming in through the borders, through the truck drivers. And a lot of people are like, oh no, truck drivers are the problem. They're bringing COVID. We were fine when lockdown, we were safe until truck drivers came into our country, And I was really impressed, like in my country, private sector launched campaigns to actually protect truck drivers. They actually went all out doing posters, billboards saying the reason why we are fed is because of truck drivers. The reason why we have commodities is because of truck drivers, because we are all at home. But life has to carry on. We need food, we need fuel, we need all of that. So they just literally launched this campaign about, thank a truck driver. The reason why you're alive is because of that. And you would have never thought that a truck driver would be your hero in the middle of a pandemic. So I think that's just one of the remarkable things to show that, there were really a lot of opportunities for people to really do extraordinary things, which is the reason why we are here today. way. So maybe just to say, why is it important that we actually honor and celebrate these heroes?
Oh, absolutely. We need to honor and celebrate our heroes. And for me also, it's congratulations to everybody who, again, really went out of their way to just make a difference, not just in their homes, but in the society. In Kenya, for example, our president was on live television thanking the workers, the healthcare workers, everybody, but in particular, during one of the big national celebrations, he gave medals to some heroes, and I really want to mention them. Some of them is Professor Omwanzala, one of my mentors, my heroes. He's a virologist, and we thought we would live in our own cocoons and under the microscope and everything, but having to hear his name mentioned by the president of Kenya as one of the heroes, because he stood out, he educated Kenyans on what the virus is and how to protect ourselves. He was a national government advisor on COVID. The other person was Dr. Lois Achieng, again in Kenya. She's an infectious disease expert. And again, to hear her name, I mean, for us in the medical world, we think we live in our own we don't get recognized, but to hear one of our own getting recognized, really, we all celebrated those awards because we felt, okay, we are making a difference. We put our lives at risk. We are facing the challenge face to face. That was amazing. But not just that, we had also other people being celebrated at a national platform. And again, that really boosted the energy, that the morale that, okay, this washing of hands, some people who made the sinks and the taps so you can just use your leg and the water flows, again getting recognized. Wow, was amazing. The atmosphere within the country really boosted us. You know what, we can do much more. We are doing something, and that really brought the community together. Of course, in Kenya the political atmosphere is always very high, but there are some certain aspects that really bring us together. That was one of them, celebrating our own, not the celebrities you see every day on TV,
the
but
usual influencers.
We say the common wananchi in Kenya, the common man. So that for me, I felt that was important because it really gave us that morale and energy to make more difference.
Absolutely. And even at the grassroots level, I remember seeing, I think, something on TV about a school where they actually give rewards to the student who washes their hands more, or who guides the other students on how they should wash their hands, just as a way of encouraging them, create an incentive for them to actually get a reward for complying with the COVID-19 restrictions. So I think it was remarkable. But of course, we know, Reverend, that exemplary leadership or heroism does not come without challenges, especially in Africa. So perhaps maybe you can highlight some of the challenges that were faced by some of these people who were doing really outstanding work.
Yes, like I said earlier, COVID was a mystery to us. How do you contain it? And so the very fact that I don't know what I'm dealing with, so I don't know how to prepare for it, was in itself a risk. And for people to brave this risk and reach out to the other people is the point of heroism that we're talking about. Our government, Doctor has already referred to the president over here, celebrated on a national scale. MTN, this telco in Ghana, also at the end of every year, they do the Heroes of Change. It's an award ceremony where people who have done outstanding things, innovation, added something to community, added something to better the lives of other people. They celebrate it, but they are in numbers. Very few people.
Very few.
And I would like to believe that there are an uncountable number of people who did even little things in hidden places. Who contributed to the fight of COVID. And I think they all need to be celebrated. The point of this commendation is, number one, to show that there are a few good men. Have you watched that film before?
Yes,
There is a few good men. When everybody is turning away, there are people who brave the challenge, risk their lives, sacrifice something so people will live. They don't have to have any common ground with them, family-wise, race-wise, whatever-wise. They are just there for humanity. Number two, that it can be done. So next time around, you see the example that somebody showed in the previous. And then it gives you the strength, the fortitude to also attempt to do something else. Like she was talking about these inventions and all this, what we just watched. Somebody said, oh, if somebody can do something or take advantage of a crisis, of a challenge, and think some solution through, it's an inspiration that we should all derive something from in celebrating or in commending these heroes of the pandemic.
Absolutely. And like you're saying, there were a lot of innovations that came about as a response to COVID-19 at all levels. I mean, tech innovations, traditional innovations, media, and in all.
Media.
Exactly. Yes. So, I'm sure you're exposed to a lot of this, especially because we showcased a lot of them on Africa Health Check Season 1 and Season 2. Which one was outstanding for you? Of all the innovations you've heard of or come across, which one, was the one where you're like, wow, that was actually a brilliant idea?
Well, again, for me, there was several. I get wowed by innovation. And I guess I can first say there's someone called Sam Gishuru. He was interviewed in one of the episodes, and he came up with a platform called Kidato. Kidato here means class in Kenya, classroom. We had children at home in Uganda, I think the whole year, 2 years, in Kenya, a whole year. And such a simple solution. He came up with a platform where, again, using social media, using Zoom technology, he created a virtual classroom with different classes, and not just classes, educational programs, but also self-improvement programs for our children, for our young adults. And I remember even my children logging in just to see and learn, and they got quite a lot from that, because at that point now, we were all now looking at virtual platforms to continue learning at home. And I know this Kidato has grown right now. They have a center. I drive through that center and I see it and I'm like, wow, we featured Kidato on African Health Check, and now it's grown into something massive. Just now, I follow them. They advertising for a holiday camp for kids, and inside the camp there's coding, there's exercises for mental health, for physical exercises as well. And I thought, wow, this grew from, I could have thought of that, and now it's grown into this massive thing. So for me, that came right in my mind.
It's wonderful that it's even continuing past the pandemic. So it wasn't something that was only beneficial during the peak of the pandemic, but we're continuing. Exactly. I do remember Sam Gishuru, really awesome work. Reverend, what was the outstanding or the highlight of all the innovations you came across?
A heartwarming story of a nurse that works in the in southern Ghana. Apparently she comes from the northern part. And she was thinking of all this information about COVID transfer, all these, how do my people understand? It's in English. It's in big English. So she decided to translate all that into her local language. And then with a megaphone, took time, went to the villages, and then shared all these things with the people. And they understood and they benefited. To me, it's such a heartwarming story that says, I cannot forget my people. No matter how high, how far God has led me. I will remember them in their village. That is what community is all about. And I'll call her a hero.
Absolutely remarkable, even in the simplest form. This was something that was really transformative, because we know that language barriers are often one of the biggest impediments to people accessing services. And for me personally, I think what stood out was the restorative justice program started by the young person Achileke in Nigeria, where he partnered with the prisons service in Nigeria, and they had prisoners making masks and PPE. I don't know if you remember that episode, but I was like, wow, this is really incredible, and it's an opportunity also for the community to sort of work around, working together with inmates, and seeing them also contributing to a positive cause in society. So absolutely a lot of incredible individual heroes that we witnessed over the last 3 years during the COVID-19 pandemic. And we'll discuss more of that, but we're going to go for a quick break where we will hear what the people on the streets of Africa had to say. Stay tuned.
I think governments need to do a whole lot more in pushing for that education to be taught not only in schools, in workplaces, in churches, in any places that require community to come together, because we really need to start this war against misinformation, and we really need to make sure that people are aware of the dangers that vaccines stop them from being exposed to.
My hope for the future is that future generations, obviously, if they can cope with, finish the poverty issue through education and through other means, if a lot of these children who are aspiring to become something can do business courses and build businesses for Africa, businesses that are profitable, I think there is hope for the future.
I do it, and actually the exercise I do, I won't lie that I go jogging, I don't go what, but once in a while I go swimming. Then church, I think, is the best exercise I will ever talk of, because we jump up and down in born again churches, we dance around, so I think that exercise is a bit helpful for me.
Welcome back. We're still on Africa Health Check, and we're talking about pandemic heroes in Africa. And I just want to now talk about what we can do going forward to cultivate a culture of people uptaking their social responsibility and actually becoming heroes in their communities, in their societies, in big and in small ways. What kind of environment do we need to create for that to happen? Let's start with you, Reverend.
I think it's an environment of togetherness, coming together as a people, breaking down the middle wall of, tribal, regional barriers. Because to tell the truth, COVID doesn't know any barriers. You can have your institutional barriers. COVID doesn't know gender, doesn't know age, doesn't know color, doesn't know race. So why not forget about the differences and let us embrace a common fight for our own welfare, for our common good. To me, if we are able to do that, we will go a long way as Africans. Wars have divided us. Political differences, tribal. It is high time we look at COVID and learn lessons from that. That when this thing came and intended to wipe us all off, what did you do? We suddenly forgot who we are and where we are from, identified a common enemy and fight. To me, if we can strive in that angle, in that way, we will go a long way as a continent.
Absolutely agree with you. Thank you for that, Dr. Mary Ann. What kind of environment do we need to cultivate to have more heroes or health heroes?
Yeah, I think you mentioned some of them. It's first of all recognizing heroes, identifying heroes, because I feel people need to know a hero is not just someone in a cape. A hero is you and me. And what we use in the tools and what we have at hand. And I'm really excited to note the feature we've had today. A lady who's making such a big difference to young girls and women. Amazed to hear she even has the same product that is dispensing the sanitary pads in Kibera. Kibera is the largest slum in Africa. And I'm very passionate about those girls, particularly because they are very vulnerable. And to hear that we are talking about menstrual hygiene and showing them that, you know what, these products are just right at your doorstep. You can use them. They are there for you. She's a hero of mine. That's amazing. So just recognizing people and highlighting their story. The other thing we need to cultivate, particularly in our upcoming generation, curiosity. They have to be curious about how things work and how do we expand this curiosity. I think it's through the teacher who is standing in the classroom. So for me, I'd want to empower this teacher have platforms. I am involved in a program where we again meet teachers from different parts of Africa and teach them about first of all COVID healthcare, how to prevent COVID. That was 2020, 2021. But then moving on from there, how to use the tools they have to arise curiosity in these children. For me, for example, coding. We need our ICT science teachers to go down to that child and teach them coding classes. How do you code? Because with this coding, you come up with programs. And these programs then can make a change. Like now, a few seasons ago, we spoke about a platform on social media where our young people can log in and have a counselor come in. We have such a platform again at the University of Nairobi. We call it Rada app, where again these young students can just log in anonymously, get counseling, get different solutions they may be facing anonymously, and if they need to be seen by a specialist, again that platform can walk them through some of these things. So for me, curiosity, and how do we expand this curiosity, the environment our children are growing in, the teacher in the classroom, and that way in the next 10, 20 years, I'm really excited to see where our young people are going to take us, because they are the next leaders, they're the next generation coming up with innovative tools. I'm always thinking maybe one day I don't have to drive through potholes and traffic. I will drive through the air, so
The potholes that change your radio channel.
So I'm very, very excited about the future.
Absolutely. I think a common theme that is coming from both of you is around unity, caring about the community. Exactly. You cannot be a hero unless you actually care about your community. And I tend to say that if you trace back history of us as Africans, we've always been about helping each other. That's why we have Ubuntu or Ubuntu. We've always been about, you are because I am, let's work together, but it seems somehow we've dropped the ball on that. There's, an increasing attitude of individualism. So where did we go wrong? Pastor, let me ask you to put on your reverent aspect here. Where did we go wrong that we are no longer, the conviction to want to help your community is not as great as it used to be or it should be for an African?
It's the knowledge that we impart, whether we give out there. And certainly it doesn't begin when you get to university. It's from childhood. I think within the family unit, parents need to inculcate this thinking that I need to raise my child to appreciate and recognize other children around. And then put them into work teams so they can work on things together. And then they grow with it. Dr. Mariam mentioned that the future is our youth. This concept, this discussion will focus more on the youth. What kind of educational curriculum they are going through, what kind of opportunities we have for them to test out these things before the problems happen. Because certainly, if you check the backgrounds of this lady who has done this great innovation and all others, there might be a common thing. Someone taught, someone imparted the knowledge, someone imparted that sense of humanity, being there for humanity. So there we should. I'm using that to think about a wash, water, sanitation, hygiene, and I'm thinking, when on earth will Africans appreciate clean environment? Where do we begin? We go to the leaders, you go to children, you go to schools, you go to churches. And when it's all said and done, it begins. So if we can live this out on a smaller scale, at home, at school, in the church, then we take that to the larger society and it impacts. But the point is, do the little that you can. You don't wait for anybody else. Do the little that you can for somebody in a different context, and then it will apply yet in another context.
Absolutely. Really, really wonderful. Maybe we could just maybe have you add on to that Pan-Africanism and heroism in Africa as you give your parting shots.
Well, yes. So again, unity in the homes starting from home, I really like that. We need to spark those small habits that, again, will raise that spirit you're calling Ubuntu. For me, for example, in my household, I get shocked if I see my child throwing something like waste just on the road, on the streets, even a banana peel. And I like them to see that I'm shocked and really disappointed.
Discouraging that.
Because they'll grow knowing, oh, this is something wrong. So now I'm seeing now my kids are teenagers at that age. They're very careful in terms of how they dispose the waste at home, how they clean up after themselves, because I believe they're the ones who go out there.
Learned behavior.
Yes, learned behavior. They'll go out there, and again, if another person sees them doing the correct thing, we'll have a clean environment.
Absolutely.
So for me, curiosity, to spark that curiosity right from childhood. So that's why I'm always very passionate about teachers. But then again, the spirit of unity, what brings us together? We had COVID bring us together out there. Again, I remember watching the news, CNN and Bill Gates and other people are really worried about Africa. This is happening in America. What's going to happen in a slum like Kibera? It's going to finish them. But then again, the next news article was the Kibera people came together. They had artists drawing, masks, how to wash your hands on the walls of, the shanty neighborhoods. But you go there right now, there's artwork. Artwork of people washing hands, artwork of people wearing masks, in Swahili saying, protect yourself, protect others. And I was like, look at the resilience of our people. They thought we would be finished, but we came together, Ubuntuism, the artists, people, we don't even think, okay, they'll draw something, but they were drawing now, things that would make
key
a
messages
difference to our people in the language that people understand. Artwork, they're like, oh yeah, I need to wear my masks. So I think that's simple as
I think that's really beautiful. And talking about creativity and people in the arts, we actually had a feature here from a young person, Emmanuel, from Tanzania, who also was using creativity, innovation, and arts. They had the visual aided project that they started in Tanzania. So he actually reached out to the Africa Health Check team to let us know that he actually got an award, a UN SDG Changemaker Award. So he was really, really happy that we gave him an opportunity to be celebrated, to get recognition for the awesome work that he's doing. So definitely, it does make a difference. And I always say it's the small things that you disregard, like, wall painting, drawing something on the street. You never think this is going to change the world, right? But ultimately, it is what makes a difference to ordinary people's lives. Maybe let's take your parting shot before we wrap up, Reverend.
My parting shot will be what this woman did.
Yes.
It has given her job. It has given her money. It has given her value. Most of the time, Africans, many people want the money without work, without service, without contributing, making any change anywhere. It doesn't work. First, build a skill, get a skill, develop your talent, perfect it, and then look for a need. Meet that need, and the money will follow. This is exactly what this woman has done. So if problems come and people will sit down and think a solution, that would be the pathway to wealth.
Absolutely.
That is exactly what this woman has done.
And that's exactly what you said. Find the solution, and then the money will eventually follow you. Right? I think that really brings us perfectly to the end of this discussion. Remember that you don't have to save the whole world by helping one person, but you can change the world for that one person. Start where you are with what you have. Make a difference in your community today so that you can also be a champion, a hero in your society. Before we wrap up the show today, I'd like us to highlight our African health champion for this episode. Her name is Judith Kandiru, a Ugandan health worker who uses a megaphone to encourage her community to get vaccinated. Let's have a listen.
Judith Kandiru has become an Africa health champion in her own right, using her voice and her uniform to advocate for the health and well-being of her community. Armed with the trusty megaphone, Kandiru takes to the streets of Yumbe district, spreading the message of the importance of COVID-19 vaccines. She knows that many people still hold reservations and doubts about the vaccine, and she uses her knowledge and expertise to dispel these myths. Through her tireless efforts and unwavering commitment, Kandiru is not just a healthcare worker in Uganda, but a true hero, an Africa health champion who is leading the way in the fight against COVID-19.
Really inspiring, and I hope as you're watching her story, you are not just admiring it, but you're also being challenged to do something today. And that brings us to the end of today's episode. From my awesome Africa Health Check team and I, we give you a big thank you for tuning in. Remember to subscribe, like, share, and leave a comment on all our digital platforms because we would love to hear from you. Remember to subscribe, like, share, and leave a comment on all our digital platforms so that you may form part of the stories we highlight here. Do follow us on Facebook, Twitter, Instagram, LinkedIn, as well as our YouTube channel so that you get updates on all our episodes. Until we meet again, same time, same place, same date. Remember, the future is Africa, the future is today.